All right, good morning, good afternoon to everyone that's joined so far, depending on where you're zooming in from. So welcome to the first learning session of the annual convening. Before we get started, I'm going to run through some logistics, just some few things to take note of before we get this session started. So let's go ahead and just remind everyone to change your Zoom name. Here are just the instructions there to rename to include your name and your state that you're representing. Also, if you're dialed in, here are the instructions to change your audio if you were calling in by phone. This will allow you to connect your face to the phone that you're calling in from. So when we have some question and answers, we know who the questions are coming from. And then lastly, please feel free to use the chat to ask questions and present ideas, but also ensure that you're muting yourself when you are not speaking, so we don't have any interruptions to the great speakers that we have today. Okay, I am going to turn it over to Wei Bing to introduce the session.
Great, thank you, Howard. And I'm not going to use any slides. I'm just going to speak for a little bit. So like Howard said, my name is Wei Bing Chen. I am the Deputy Director of the PDG B-5 TA Center. And one of my areas of expertise is in coordinated eligibility and enrollment, or CEE. So it is my privilege to welcome you to this learning session, which is on data systems and how it can support CEE, or more loosely, coordination in the early childhood system. I wanted to acknowledge Howard before we got too far into the session. He is a TA specialist in our center, and he did all of the hard work organizing this session. So thank you, Howard. So our plan for today is for me to spend about 10 minutes doing a quick introduction to this topic before I turn it over to our state presenters who are from South Carolina and Illinois. And they will be sharing with us specifics on how coordination supported by data systems look like in their states. But first, I'm going to say a little bit about CEE broadly, because this can be a complex topic, and CEE can mean a lot of things to a lot of people. It goes by a lot of names. So some folks call it coordinated enrollment, coordinated eligibility and enrollment, which is the term I tend to use, or CEE. Some states call it coordinated application eligibility enrollment, and so on. You'll also hear people talk about coordinated intake or centralized intake. These are terms that are more often used in the home visiting, behavioral health, and housing support fields. It is a similar process to CEE though, but may have some slightly different characteristics from CEE, such as the use of staff in a navigator and intake coordinator role. But today we're going to talk about coordination more broadly and focus in on how data systems can be used to support this coordination. So in general, I like to think of CEE as a strategy that states and localities can use to build a more robust and interconnected early childhood system. And you all know that our theme for this year's conference is strengthening systems. And so a lot of our sessions have the focus at this higher level of systems building. And so CEE is, the way that I think of it is, it's a strategy that localities can use to really grow that connective tissue between programs within a service sector. So such as between state pre-K and Head Start within early learning, or across service sectors, such as across early learning and social services. And so I think of the connective tissue between various organs of the body. And so the CEE is really taking these existing structures and helping them function in a more coordinated way. And it does this because through the process of coming up with a process for CEE, programs get together and they co-create common processes for the process that a system has to have starting with recruitment all the way to the enrollment of children and families into services. And I tend to think of these in some buckets. Number one being the recruitment of families, two being the application for services, three being eligibility determination, four being program selection, or in some instances where there are local providers involved, matching of families with the providers themselves. And number five, the actual enrollment of children and family into services. And so CEE can be any one of those steps. It usually refers to the series of steps, and many localities or states will create a process where they start with the recruitment and then they move all the way through to enrollment, joint enrollment. Sometimes they only choose to do certain pieces of it, depending on the logistics of what their system can support and the resources they have. So there are varying degrees of coordination, like I just mentioned, and that some of these forms of coordination can be lighter touch. Some of the examples that I've seen are like an online preliminary eligibility calculator, and this can be at the state level or it can be at a local coordinating entity level. And then there are other forms of coordination that are more extensive. And one example of this is fully coordinated enrollment, where families fill out a single common application for all providers of a similar service, and then are matched through a back-end process to a single best fit provider. And so this requires a lot of, as you can imagine, a lot of coordination by the providers themselves to come up with a process for how they're going to sort out which families go with which provider. And coordination can happen at the state level or at the local or regional level. I mentioned, the online eligibility coordinators can be housed in a website. And so any coordinating entity can create that for whatever audience it is that they're trying to serve. But there are certain types of coordination that are better suited for one level or another. And I think you'll hear a little bit about this when we get to our state presenters' presentations. So what do I mean by certain types of coordination? And we're going to talk a little bit about example coordination activities here. So our TA Center did a review of what the states that were awarded first round PDG B-5 renewal grants proposed to do for their CE activities. And we found that the proposed activities fell into a couple of categories, which I thought was really interesting. And the most common type of activity, which was proposed by 16 of the 23 states, was the development or improvement of an online single point of entry web portal or data system. And what I mean by this is a website or a web portal. Most often these were family-centered web portals where families could go to a single website to easily access a whole range of services. And other than one state, these were all proposed to be carried out at the state level. So these were states writing in these renewal applications saying they were going to build a web portal at the state level, where the data were going to be kept at the state level and the website was going to be managed by the state. The scope of the programs or funding streams that were to be included in these proposed family portals varied, but in many states, they were being tied to data infrastructure that was created or is being created for economic support services, such as WIC, TANF, SNAP, those types of programs, or healthcare services such as Medicaid and CHIP. So South Carolina, which is one of our states presenting today, is an example of a state doing this, and we will hear from them. Rachel Hatton-Moore, who is the 2-generation coordinator at South Carolina First Steps, and Georgia Miartin, who is the South Carolina First Steps Executive Director, will be presenting their work on First 5 South Carolina, which is a coordinated eligibility and common application portal. And I'm just going to say a couple more things about what Illinois' presentation is before we turn it over to Rachel. Okay, so the other piece that we discovered in our review of the renewal states' proposed CE activities is that the next most common type of activity, which was proposed by 11 states, was some form of pilot or localized CEE implementation. So these are local level activities that are implemented by either local providers that are coordinated at a county or regional level, sometimes a hub of some sort, but they are implemented with state oversight since PDG B-5 applications are submitted by the state. So these are all instances where the state was involved at some level. But I should note that there is definitely CEE occurring locally and regionally without state involvement in various parts of the country. And there is also CEE work occurring in states that don't currently have PDG B-5 renewal grants. But today we are focusing on work in renewal states where the state is involved. So Illinois is an example of a state where there are CEE efforts that are going on at the local level, but the state is providing guidance and resources. So communities in Illinois are using a platform called IRIS, which stands for Integrated Referral and Intake System, to support referrals and coordinate and facilitate coordination in their early childhood system. Mary Oram, who is a research coordinator at the University of Kansas, which is where IRIS was developed, will first share the IRIS tool, and then Deborah Huang from the Illinois Governor's Office of Early Childhood Development will explain how IRIS is being used to support systems development in their state. And they're using IRIS, as far as I understand, and they're going to tell you a lot more about this. They're using IRIS locally to facilitate coordination, especially in places where they haven't been able to implement coordinated intake. So just so you all know what the format is for today's session, our speakers from South Carolina and Illinois will each spend about 30 minutes presenting, and then they will have about 5 minutes to answer questions directly after their talks. So feel free to put your questions into the chat or save them for the end of the presentation. And then Howard will do a quick wrap up before we disband. So I will now turn it over to Rachel and Georgia from South Carolina.
Thank you so much. And thanks for the wonderful orientation to this. It's so encouraging to be in such great company. And I want to just tell you what our hope is today. Our hope is that you'll be inspired, that this will kick off conversation. We do have an interactive portion of our presentation where we hope that there will be time for us to learn from each other. And I want to say that from my heart, because one of the things that inspired me to come back from a trip to Colorado was an Aspen Institute convening, where I got to hear about a coordinated portal that Colorado had created. And it made me think this is doable. So I hope that coming out of this, you will say, this is doable. And we are really proud that even though we were starting in many regards very behind here in South Carolina, we think that through the investment of the preschool development grant, we've been able to catch up to be able to be a state that meets families where they are and that is responsive to the needs that our families told us they had through the initial preschool development grant planning needs assessment process. So Rachel, if you want to go to the next slide, I just want to begin with our vision. And that's a vision of a mom and a dad who have an infant and a 2-year-old and a 4-year-old. And this is a family that I'm thinking of because it's a family that I met in the park one day. I have 3 young kids myself. So I go to the park a lot, and I was talking to this mom, and she was sharing with me that before the pandemic, she and her husband both worked full time. It was before they'd had their newborn baby, who was a pandemic baby. And she shared that they had care arrangements for their children, that they were not particularly reliant on the system of public supports for themselves and their children. But because of the pandemic, she had needed to stay home. Some of her care arrangements had fallen through. She had this newborn baby, absolutely didn't feel comfortable at that point with putting her youngest child in childcare. And she had sort of realized that there were many parts of the system that she didn't even know about as she was beginning to navigate and try to figure out about pre-K4 for her 4-year-old. She realized that this was a complex system. And so our vision is a vision of a single portal into what is currently a very complex system for families to navigate. A system that this mom and her husband and their 3 kids can navigate and can easily and quickly in a way that honors their time and their desire to have time as a family with each other, not time spent in waiting rooms and time spent navigating complex systems, that we would create a system that would solve this family's current and pressing needs and would also help open the doors to future services. So Rachel, if you want to go to the next slide. The beginning of our experience here in South Carolina was mapping out our flow of state and federal funds into a system that when we put it on paper and tried to make it as simple as possible with pretty little icons was still really complicated, right? And we had not done this as a state. This was created about 3 years ago. And you can see it continues to be updated, most recently less than a year ago. But what you can see here is a flow of federal funds down into a system that includes South Carolina First Steps, which is the state funded deliverer of home visiting and childcare quality enhancement, some scholarships. Department of Ed is a conduit of funding for pre-K 4 and some IDEA Part B services. Our social services system, our health and human services system. In South Carolina, we have this combined entity that does everything from uranium regulation and the safety of clams all the way over to WIC. So that's all within one organization, and it's called DHEC, Department of Health and Environmental Control. True story. And then we have our Children's Trust, our McVie agency, and we also have a standalone Department of Disabilities and Special Needs. So that's not even all of them. That is the state system that, together with the Head Start Collaboration Office, constitutes our state's Early Childhood Advisory Council. On top of that, we have a mental health department, which is not formally a part of our Early Childhood Advisory Council, which should be. We're working on that. And other pieces of this system that, as we have gone through this process of building out a coordinated, centralized system that we have realized need to be a more formal part of this. So if you want to zoom into the next slide, Rachel. So I'm zooming in here for a reason, and the reason that I wanted to zoom in here, it's hard to see on those other slides, but notably in 2019, when through the Preschool Development Grant needs assessment process, we began asking families in our communities what their needs were that they saw. And we actually, as a state, heard from 3,114 respondents to a survey. We held 15 regional meetings and heard from 440 participants in those, and another 1,495 people participating in 130 focus groups. So we really, really listened, right? So when we heard from over 4,600 people, the number one need that we heard from families, from parents with young children, in the category of early care and education, which is the domain that you're looking at right now with First Steps, Department of Ed and Social Services, which is the recipient of the child care block grants. The number one need that we heard was, and here's how it was articulated, finding high quality childcare and early education programs. Finding, right? So that was really essential to us. We said, we thought it might be affording. It wasn't affording, it was finding. And so that is part of what made us decide as a system that we would begin our eligibility portal building endeavor in that very first year of the Preschool Development Grant, zoomed into what we now have begun calling writing the first sentence in a chapter in a book. The book you're going to hear about today is called First 5 South Carolina. It's the whole comprehensive portal, which is really a 1 through 5 from what Wei Bing said earlier, all the way from eligibility into a common application. But step 1 was practicing, was trying it out. And so if you want to go to the next slide, Rachel, what we decided to do was, here you can see those chapters as I like to talk about it. And if you imagine zooming into that blue part that we've called childcare and early education, a subset of that is pre-K, right? So in South Carolina, we have a pre-K system that looks just about as convoluted as our whole state system. So that pre-K system that we have here includes 7 different funding sources, all with different eligibility criteria across 3 different domains. And those domains including public schools, private childcares, and private schools. And Head Start, of course, being in both what we would call childcare centers, center-based Head Starts, as well as in some public school partnership programs. And so we decided to create a single umbrella called Palmetto PreK to build and launch a portal into this piece of the childcare and early education system, the pre-K piece. We launched it, we built the whole thing, came to the agreements, did all of the data sharing, mapped the back end, and launched it in the first year of our very first preschool development grant. It's now been a live portal for about a year and a half, since February of 2020. And we've had 10,000 plus leads. Those are eligible families who came through that portal and connected with the pre-K system alone. So the reason I share all of that as process, and Rachel's going to talk in more depth about First Five itself. The reason I share all that, if you want to go to the next slide, Rachel, is because it was important for us as we were deciding as a system whether it was doable, whether we had the political capital, and frankly, whether we had the will to build a single portal into 60 different programs that were state, federally, and locally funded across 10 agencies. We wanted some proof points. And so having Palmetto PreK be something that we decided upon, made happen, launched, and worked out some of the kinks, and then frankly saw that it worked in delivering all of us with people who could now access our programs who were not previously accessing our programs, is really part of what built the momentum to get buy-in and interest and willingness to participate in First Five. So Rachel, I'm going to turn it over to you to talk us through now how we got to First Five. And if you want to say anything, I didn't really share much about the planning year, but I should say, let me just do that and then kick it to you. So during that period of building out Palmetto PreK, doing the needs assessment, we also built what I would call a really big tent committee. We said, if you are interested in helping us envision what this single portal is into our complex early childhood state system, come join us. We have a working group. We included system navigators, we included nonprofits. Most of those state agencies were at the table, as well as some local community-based organizations that do sort of a local version of system building. And so that committee, that first year sort of working group committee, created the tagline and named First Five South Carolina. They created the commitment and wrote a proposal, and that proposal to do this, to commit to it, was then formally adopted in a motion by our state's Early Childhood Advisory Council, which is that system governance entity. And part of that commitment, I do want to just go to this meeting. I love governance. And one of the moments that I always think back on, and then I'll turn it to you, Rachel, was the moment where our state's Medicaid director, who sits on that Early Childhood Advisory Council, said, now, just to be clear, these are recommendations to have this common eligibility portal and common application that's coming out of 1 year's worth of funding. And at that point, we were sort of delayed in finding out if we were going to get the next 3 years of preschool development grant. And he said, so just to be clear, if we're committing to doing this, what you're asking for us to do is to commit to doing this, even if those funds don't come through. And we said, yes, that's the recommendation. We're asking for a joint commitment from across these 10 agencies to pull our resources, to pull this off, to make this happen for kids and families in South Carolina. And it was a unanimous vote. Everyone said yes. We were very grateful to receive the 3 years of preschool development grant funding, but having that level of buy-in was really key. So we hired Rachel, she came in, and I'm going to turn it over to you because that's where you pick up.
Thank you so much. I'm so excited to be with you all today. This is something that is a big passion point of mine. So we began an accelerated timeline for developing First Five in April of this year. And so I want to take a moment here for us to think about what eligibility and common eligibility looks like on the family side in the states that you are all coming from. What is it like for families to navigate now? And then I want you to go to Mentimeter and enter a few words about what it's like for families right now. And I'll copy this link and drop it in the chat for you. So we'll just take just a moment to do this. I'm actually going to go back a screen so that you have a QR code if you'd prefer to do it that way. I see we have 2 responses. Now we have 4. And I think you can enter up to 5 words or phrases. So I'll give you just a couple more minutes and then we'll share it out among the group. Right, it looks like we have a stable number of responses now. So I'm going to go ahead and flip back over to the map. And it should show us our word map. Well, I'm sorry about that difficulty, but I can imagine that it says things like complicated or difficult to navigate, or spend a lot of time having to go to a lot of different agencies to find out if I'm eligible or not. And I'm sure that a lot of families in your states don't even know what they may be eligible for or where to even start. So that's one of the things that we're hoping that First Five can do, is help families think about where they can even start. Some of the guiding principles that we had in doing this work is that it's public facing. So it is something that can be used as a tool for publicly facing programs for families, and that will have publicly held data then from our work that can align with our early childhood data system that is being built concurrently, as well as the state longitudinal data system. And so that we can align those efforts together and make sure that First Five is able to support and align with all the work that's happening in our state. One of the other things is we recognize that Palmetto PreK allowed us to accelerate our work in this area, especially in the early care and education, and populate the other 5 domains pretty quickly. And one of the ways that we did that, I'm going to talk to you about the how of what we did, is we had a lot of meetings. I'm sure that's a common element for everybody, but we spent some time thinking about all of the flow of funding, programs and services that were represented on that map that you all saw earlier. And then we took those programs and services across those 10 agencies and figured out what all of the details for their eligibility and enrollment processes currently looked like. And we collected a lot of documents. We had follow-up conversations about any questions we had. And then we took each of those items and we put them on a really clunky and unattractive Excel document and figured out from there what the common elements were. So we looked at income, and we knew for some programs, because of COVID relief, it was 300%. And then for other programs, it was 50% of the federal poverty guidelines. And so we figured out how we could ask questions of families to find out, based on the most common pieces of information to the least common, what they might be eligible for based on the information that they input. And so right now we're actually building that screener and trying to have it as simple as possible for families so that it doesn't take them much time to find out an array of services that they're eligible for, and to get them as close to enrollment as possible based on the information that they input. And they'll be able to input their location and find out, mapped to their location, what programs and services, as well as who their local contact people are to get enrolled. So like Georgia mentioned, there are 60 programs, and of those, 44 of them will be included on the eligibility screener, and 17 are included for information purposes only, to direct families to them. And so what that means is we also had to figure out how to describe all of these programs in such a way that families can quickly find out which may be useful for them, navigate by these areas of health and safety or food and nutrition, to which ones are most salient to them at this time. So if they're looking for everything they might be eligible for, how to do that. But if they're looking for specifically one category, helping them navigate easily to that, and be armed with tools to help them learn more about these issues and these topics, not just connect with a program. So in that way, it'll be for services and programs, as well as general information to support their knowledge and choice. So in that way, we could go as deep as we need to, as far as, is there one centralized number to call, or is there a local implementation partner available to contact in your area. So it really was up to agencies based on what was feasible for them at this time. And so in that way, First 5 SC is also responsive and iterative, meaning that as agencies change their processes, they can go deeper into allowing families to participate and find exactly how to get connected to what they need at that time. So one of the other things that we had as a major consideration was making sure that First 5 SC aligned with the Birth Through 5 plan, and making sure that the programs and services represented on First 5 also demonstrate sort of the collective work that we're all doing, and that it aligns with some of the other goals and strategies that we're doing, so that families have a central way to access the system. And so next year we'll be working on the common application, and where we're at right now is we've gone through design, and I'll go ahead and move to the next screen. So we've moved through the design phase. We've chosen colors and illustrations that are inclusive and that are also easy on the eyes, because we recognize that some families might spend 5 minutes here, but other families might spend 50 minutes here learning about different parenting topics or learning about different programs and services. So we want to make sure that it's soothing and it feels like a respite, since we know that families are often overwhelmed with information. We want to make it easily digestible, but also comfortable to come to and positive. So we've been really careful in the language that we use to make sure that it is positive and affirming, and helping parents realize that they've made the right choice and that they're doing a good thing by learning more and helping their families. One of the other things that I also want to address right there is that we wanted to, one of our guiding principles was inclusion of family voice and working with our partners and stakeholders. And so between now and soft launch, which is on December 1st, we'll be having 5 community pre-release convenings with different stakeholder groups, all of our PDG partners, all of local navigators, and then also with families. And at these meetings, we'll show what the site looks like and what the portal looks like, and then move more into how do we jointly use this resource and tool that we've made, and how do we roll it out into our communities so that it's as valuable to a grandmother in Horry County as it is to a young mother in Lee County, so that families, regardless of where they are in the state, recognize that they have a resource that helps them navigate where they are. Because like many of your states, what's available in one region may not be universally available to all South Carolinians and South Carolina families. So we really want to make sure that it's locally responsive as well as state level responsive. We also will be having open houses which is difficult in a virtual world, every Monday in November to answer questions. And we'll also be doing really extensive site testing with really like test user cases with different eligibility criteria to make sure that it returns the right results and that it's easy to use and that the questions make sense. And so we're inviting a lot of our partners to look at that and to help with the testing groups. And that'll be done at the first part of November. So we're really, like I mentioned, on an accelerated timeline, but we're so excited about having this available and available quickly to families. And because it's available quickly, we also recognize that it will change and grow over time. It is supposed to. It's supposed to be something that our state can use in a way that meets the needs of families in real time. And so that families, whether it's midnight or 2 a.m. when they're waking up with their infant, they can go on their phone and look at what's available. There'll also be a request a callback feature so that for programs that have the ability to do so, a family will be able to put in their name, contact information, and the best time to reach them. And it'll be emailed to the the program or service so that they can reach back out to the families. And that'll help accelerate families getting information as well. We're really excited about this being available to families. One of the things that struck me doing this work is it hadn't been done in our state before, to sit down with this many programs and services and find out what's possible. And I know that not every state has this on their radar or something they're developing, but I know that many are. And so some of the lessons that we've learned along the way is that it's really important to ask the right questions. When you ask for eligibility right now, it means different things everywhere. So you have to really look at those individual elements to make sure you understand exactly what that means to that program or service, so that it can, in essence, be translated into common terms that match between different programs. The way that we're building the screener right now is entering all of these discrete pieces and developing like a flow logic for them, so that one might override the other or vice versa. Or if they must have a series met to be eligible, those questions are asked in a way that mean that a family doesn't have to answer 45 million questions or spend a lot of time doing it. They'll be able to do it in a quick manner with one question that can answer several needs at a time. So I know that I've kind of blew through that at a really quick pace, but I want to leave time now for questions. If anyone has any questions, I know that I could talk about this for days. So we'll open it up now for questions.
And I'll just jump in to say, if people want to ask questions in the chat, feel free to drop those in there, or you're welcome to unmute yourself. But now would be a great opportunity to ask Georgia and Rachel any questions you might have about their approach to designing this, and maybe some strategies that they've used in implementing their work. So I'll just pause a moment and let folks respond.
Yeah, and one thing I was going to offer up as well, if it wasn't clear from our talk, I am not the implementation scientist on this, and I am not the one who's been doing the legwork. But in a state like South Carolina, there's a lot of legwork to be done at a lot of different levels, and some of that is the very logistical, technical work. And then there's also sort of the buying in both at the agency level and then even politically, and building that political cover in a very conservative state to build positive momentum behind access to a portal for public benefits for families in poverty primarily. So I think the other thing I would offer up is that we're happy to talk on either ends of those parts of what it takes to build something like this out. And I do see there was a question.
Yeah, so the question came in, is the South Carolina site aligned to the CCDF requirements for a child care consumer education website?
Rachel, do you want to answer that, or do you want me to answer it? Or is Michelle on to answer that?
I don't see that Michelle's on, but if you have an answer to it.
So I don't have a technical answer. I will jump out and say I do not have a technical answer. What I do want to offer up, though, and it's why I said if Michelle's on, is that part of our process here was to build off of the child care development fund block grant funded access portal that already existed, because we realized that there was a lot of legwork that had been funding this work already. And so Michelle Bowers, who has been an incredible leader for our state and partner in this, the CCDF partner is actually who has the preschool development grant. We are just a funded partner in this work. And so we actually started out by trying to figure out ways to build on the work that they had already done for CCDF. And I will say, although the procurement itself was, as is always the case in state government, as many of you know, it's a beast. The vendor who ended up getting this award, I think I was not on that committee, the selection committee, but one of the things that made that vendor really appealing, I think, to the selection committee is they actually were the app developer and web vendor who built out our CCDF portal as well. And so they had the ability to interconnect existing systems. So just the last thing, if we don't have questions, is you are going to move on shortly if we don't, but I just wanted to kind of, again, put a marker in the sand. I know I said we started a little behind as a state, and just to be really clear about that, our different parts of our early childhood state system are at all different levels of capacity. And so there are parts of our system, where you can't even find out basic eligibility information in any publicly available place on a website. Like there's not even like a PDF document that says the eligibility criteria, where the system says, call this number to find out if you're eligible. And then when you call the number, the person at the other end, says, is your child handicapped? Like, I'm just being real. So I'm a mom with 3 kids. I moved here from another state. I had 3 little kids. That was said to me about my child who was on Medicaid because we adopted her out of foster care because she was medically needy, right? Like that was said to me. That was what the eligibility process felt like. So we have parts of our system that feel like that. And we have other parts of our system where you can completely go through and go from eligibility to application fully online. And so again, I don't want you to miss the nuance of Rachel saying we wanted this to be a gracious, positive place for families to come. We wanted this to go as deep or not as deep as the agencies were ready for it to go. That across 46 different programs where families will find access is a huge step in a place where we were starting here in South Carolina. Okay, I see some questions.
Yeah, so I see the first one come up. Not sure how you work with Head Start programs. So maybe if you guys want to touch on that one first before we move on to the next one.
Sure, Georgia, I'll answer that one. And then if there's anything else you'd like to add, we work really closely with our Head Start Collaboration Office through Palmetto PreK, and they're also on the board of, or the ECAC, the Early Childhood Advisory Council in our state. And so all of the Head Start locations in South Carolina are mapped to Palmetto PreK, and they sit on our portal and portal work group and talk about accessing it and having leads generated from Palmetto PreK. And all of that information from Palmetto PreK will also be ported into First 5. So we haven't had to recreate the wheel there. We've just had to integrate it into the early care and education portion of First 5. And so that information is there for the Head Starts.
I think the other thing I would add is that across the development process, it's been really important for us to hear both from the director level decision makers or the Head Start Collaboration Office, sits in this formal role. The elected leader of the Head Start Association is also a member of the Palmetto PreK committee. But it was also equally important for us to have a seat at the table for the people on the ground who are doing this work every day. So we have that RCM manager who is also on that committee, who talks about how she uses the lead backend, how she pulls those leads off, who asks for things like, okay, so I'm pulling leads off. Is there a system of tracking you can build in the next iteration? So thinking about all those different layers of users. I think that brings us to the next question on here, which is, the agency, state level, capital city leaders, maybe some of those regional and local leaders, and then ultimately families. What was the work of getting family voice? So Rachel, if you can talk about that up until this point and also going forward.
So one of my other roles here as the 2-generation coordinator is the facilitator for the South Carolina Family Voice Council, which currently has 11 members. And our October meeting is dedicated to review of First 5 and getting feedback from those families. And at each of the Family Voice Council meetings, we have a presenter from different agencies and programs from across the state that are publicly funded to receive feedback from the families on the Family Voice Council, who are all parents and caretakers of children ages birth through 5 who have participated in publicly funded programs and services. So that is one of the ways that we're including Family Voice in the development of First 5. They've also provided feedback to the Birth Through 5 plan, and we'll also have a meaning-making session in November with the most current needs assessment data from the PDG. And so in our future, they'll continue to help with the common application and reviewing that. And it is a stipended opportunity for families who serve on that council. We'll also be having a testing group as a pre-release convening for families in early November. And we'll be recruiting those families through the communication channels that we already have existing. We'll be having a community or a communications roundtable in effect this week that includes partners and communication professionals from many publicly funded agencies. And so we'll lean on them to assist us in recruiting widespread so that we have a good representation from families. And I see, does that answer your questions? I see one more, and I know we have about 3 minutes remaining. Anne asked about supporting families. Are there contacts available to help families navigate through learning about programs, applications, etc., or does that continue with each program individually? We are looking into that. That's one of these areas where we're being responsive and iterative, right? So I'm not claiming that we have everything done that we're going to do with First 5. That's one of the things that's so exciting about it too, is we have these opportunities to advance in this area. And so right now we're thinking about how to include navigators and what opportunities there will be for them. And that meeting will actually be next week with navigators to discuss that. And in the interim, I have 2 meetings set up to discuss opportunities around that. So if you want to check back with me in November, I hope to have a better answer for you then.
And I will just add that, you know, while we are really trying to figure that out at the state level of system navigation, some of our context in South Carolina is that going back 22 years, we actually have locally coordinated sort of cabinets for early childhood services that already exist. And that's our network of 46 local county level First Steps partnerships. So that role of being a local system navigator and local portal into the early childhood state system is actually defined in legislation as a role of the local First Steps. So we see this as a tool that will be in those local community agencies' hands, but then, you know, Rachel's really working at the state level to figure out who are those state system navigator entities that, you know, could be a help as well. So we're not starting from scratch on that. I just wanted to be clear, you know, we're kind of building onto the existing infrastructure.
Well, we have 1 minute left. Do we have one more question? Well, I thank you all for your time. I hope we'll be able to continue these conversations. And so my contact information is here, and I'll also drop it into the chat box. I would love to talk to you about what's happening in your states, if there's ways we can support you, or if you have any questions about what we're doing and the how of how we did it. Thank you.
Great. Thank you so much, Georgia and Rachel, for sharing your wealth of information and knowledge on First Step South Carolina and the Common Eligibility Portal. That was really a lot of great things that we can learn from you, and really great strategies that we've learned. We've just been able to share so much that I think is really helpful for states in the call to really learn about the approach you took and how they might be able to have some key takeaways about how they might also be able to implement that. So I'd like to now transition over to Mary and Deborah and talk about their future of coordinated intake and their shared vision for paired with data-driven communication and communication-generated solutions. So Mary and Deborah, take it away.
Hi, thanks, Howard. Again, my name is Deborah Huang. I'm at the Governor's Office of Early Childhood Development in Illinois, and we're the ones that are managing the PDG B-5 grant. And we're so happy to partner with the University of Kansas Center of Public Partnerships and Research, and Mary is coming from that side. Should we go to the next slide? Oh, welcome, everyone. So we're going to start the presentation by first providing the context to the work that we're doing. So here in Illinois, our PDG B-5 project is focused on coordinated enrollment and eligibility and our project is called IRIS for Coordinated Intake for Home Visiting Services. And we're focused on implementing IRIS and coordinated intake processes, also known as CI, in 4 home visiting communities. So to provide context for this work, in Illinois, currently the home visiting system does not have a statewide mechanism of coordinated enrollment. We do have coordinated intake communities, but the largest being through our PreK CI program, and they fund 12 communities to have one full-time coordinated intake worker. Outside of this community, prior to this project, I just realized, Mary, could you also go to the next slide?
Deborah, if you could try to get a little bit closer to your speaker, we're having a little bit hard time hearing you.
Okay.
That's better.
How does this sound? Is that okay?
Yep.
Okay, then I'll try to project more. So yeah, once again, our PreK CI program provides the largest CI communities throughout the state with 12 communities, and each of those communities have one full-time coordinated intake worker. Outside of this community and prior to the start of this project, there were 7 other communities that were implementing CI processes, and this was either done with funding support through local foundations or other funding sources, or done voluntarily. So to address this system's need, the initial PDG B-5 year brought together different stakeholders, including home visiting, early intervention, health departments, and other early childhood education and care systems, who recommended that there be coordinated points of entry throughout the state for home visiting, as well as other ECEC services. So this recommendation, as well as the prior work of existing coordinated intake communities, helped to shape what this project looked like. Also, larger state priorities that back this work include our governor's goal, which is that Illinois becomes the best state in the nation for families raising young children. So this means that every child, regardless of their race, ethnicity, income, language, geography, ability, immigration status, or other circumstances, receive the strongest possible start to life so that they can grow up safe, healthy, happy, ready to succeed, and eager to learn. In order to advance this vision, in December 2019, the governor established the Illinois Commission on Equitable Early Childhood Education and Care Funding. One of the main recommendations that came from this funding commission was to centralize our ECEC system in Illinois with a designated local and regional community infrastructures. In response, the newly established early childhood transformation team is currently working on developing these infrastructures. So in advancing these larger state priorities, this project is focused on providing tools to home visiting communities that were either already implementing CI voluntarily or were interested in doing so and are well positioned to take on this project. The objectives of this project are to increase the number of CI communities in Illinois, strengthen community systems, and to gather equity data such as race and ethnicity and languages spoken by the families. And with that, I'll hand it off to Mary.
Thanks, Deborah, and hello, everyone. Excited to be here with you today. I am going to start off my portion of the presentation by actually asking something of all of you. And so if you are a bit old school like me, perhaps you want to grab a notebook and a pen if it's nearby. Otherwise, opening some sort of word processing document can be useful. I am going to ask you to capture some notes and perhaps share some information throughout this session. And my second ask of you is to actually test out some technology with me. So bear with me here. If you would all mind going to that site, and I'm going to test something that our friends in South Carolina also tried to do earlier today. Fingers crossed for technology. But I would like to capture where everyone is joining us from today. So I know just based on the presenters and the friendly staff at PDG, I think we have a pretty good representation. I'm here in Kansas. And I'll go ahead and add my spot on there too. Thank you all for participating in this. It looks like we have a good showing from coast to coast, including the Midwest, Washington State, my home state. Very good. I'm glad to see we are represented from across the country here. Okay, and it looks like technology is working in our favor here. Thank you all for that. Okay. So as Deborah mentioned, I'm gonna pull this up really quick. The transitioning from technology is the fun part now. Lock those responses in. Okay, thank you all. I'll reshare my screen here. So today, I get to talk to you about the technology and the implementation process that is supporting the great work happening in Illinois. As we mentioned earlier, my name is Mary Oram. I'm actually from the Center for Public Partnerships and Research at the University of Kansas. So I'm just lucky enough to partner with our friends up in Illinois to support the work that's happening across their state. So as we see, we have representation from across the country today in Illinois, and I'm sure all of you know across this country, families have complex needs that affect their overall health and well-being.
Hey, Mary,
yeah.
Could you try sharing your screen again? It hasn't come through yet. Sorry.
Oh, sure. No, you're fine. Okay, are you able to see my slide?
Nope, it just says it's not come through yet.
Technology was almost on my side today. Let me try stopping the presentation on the PowerPoint and going through again. Okay. How about now?
When you go to the screen share option, have you chosen the particular screen you wish to share? When you go to the screen share option,
yeah,
on your computer, did you find multiple screens and did you choose the one to share?
Yes, I did. Yep, and I'm sharing the presentation mode now. But you're not able to see it? Let me try this.
Showing up as a black screen.
Still?
For the rest of us. Can you do a screen grab and share it that way?
Let's see. Otherwise, Deborah, do you have the PowerPoint as the backup?
Yeah, I can give it a shot.
Yeah, let's try that. Sorry for the technical difficulties.
Let me know.
Perfect.
Great.
Yep. Okay. So as I was saying, we know that meeting families' complex needs can be difficult, especially with the siloed systems that we have in early childhood, health, social services, often creating kind of a fragmented and ineffective coordination across those systems. So today, I get to talk about the technology that supports the technology and a robust community-driven implementation approach that is supporting communities with referral coordination that Deborah shared the work in Illinois. And then a little bit later, she's also going to share about 4 pilot communities and how they have implemented the tool. And so if you want to go to the next slide, Deborah. I'm going to share with you about the Integrated Referral and Intake System, or IRIS, developed by our Center for Public Partnerships and Research at the University of Kansas. It's a bidirectional referral communication tool used to help organizations connect individuals and families they serve to the right resources in their community. So through a streamlined referral process, including closing the referral loop, partners improving warm handoffs to needed services, and quickly following up on unsuccessful and successful connections. The tool is also accompanied by a community systems development framework that fosters collaborative, sustainable, cross-sector relationships, breaking down those silos and hopefully ensuring that children and family experience clear pathways to the services they need. I'm going to go ahead and advance, Deborah. Thanks. So as a time saver today, I will not be demonstrating the features of the tool, but just grabbed a couple of screenshots to demonstrate some of the features, such as a customizable shared referral form, in-application chat function, email notifications, individual referral status tracking, capacity bar to indicate ability to accept clients or referrals, and the ability to select a referral partner based on the community-created service tags associated with each of those participating organizations. As I said, referrals are bidirectional and transfer in real time. The system provides feedback to the sending and receiving organization the moment it occurs in the application and via email notifications. So no matter the type of resource a family is needing or whether the two organizations have a well-established relationship, users know exactly how they will connect a family to the needed service. Also, data collected in IRIS can be customized to community needs and is available to all users, both state and local, via the in-platform reports and on-demand data exports. So IRIS, the tool, and our Cultivating Connections implementation approach, which I'll talk about here shortly, address both the technical solutions and the adaptive change required for that cross-system referral coordination. We've seen it firsthand that health and social service can operate in a shared network, promoting warm handoffs and improving successful connections to services. So I'm going to go ahead and advance. Great, thank you. So implementation of IRIS actually started in Illinois a little over 2 years ago. The first community was actually an All Our Kids network. They were focused on supporting the needs of families and children ages 0 to 5. And as Deborah mentioned, it's also been used in communities with other forms of coordinated intake models. And so since the first community launched in early 2019, a total of 15 communities have launched across the state, ranging from everything from a 7-county region in rural areas to small clusters of neighborhoods in urban Chicago. Communities are always defined by those building them based on their own unique circumstances. So as of September 30th, 2021, you can see 512 partners have been engaged across the state in these communities. They've sent over 8,500 referrals on behalf of families, and 86% of those referrals have already had a closed loop, with over 55% enrolling in services. And community leaders across the state also benefit from peer learning opportunities facilitated by our IRIS team, connecting them with others across the state to share lessons learned and build off of one another's experiences. And a little bit later, Deborah is going to share some specific information about, again, those 4 communities that are currently participating in the coordinated intake project supported by PDG B-5 funding. Do you want to advance? Thanks. So as I said, technology such as IRIS is a part of the solution, but we know technology should support the work and not drive it. So we have paired our technology with a ready community of partners with a shared vision and implemented in a way that builds collaboration and leads to lasting change. So we'll talk about a couple of each of those pieces today as well. I'm going to advance. One last thing about the technology piece, some of the ways that we focus kind of the function of IRIS around the need of communities includes the communication and tracking features that I mentioned earlier, the customization to meet specific community needs, and as well as access and ownership of the data at the local level, where we know it's often desperately needed, and the state level, where it can be helpful to have the big picture across the state. We also have a community-driven and strength-based implementation approach that I'm excited to dig into ever so briefly with you today. Can I advance? Thanks. So over the last 6 years, creating and then implementing IRIS across this country, we've learned many valuable lessons about system development work. A few of those include that whether you are a single individual invested in creating change in your community, a small organization, or part of a larger collaborative, you can have an impact If you are a state level institution or funder, you can clear the path for community-driven solutions to support families and sustain networks. And we're going to explore that process today, taking months of collaborative work with several partners and condensing it down to you joining us today, wherever you are, and in the next 10 minutes. So no pressure. I hope you have that notepad ready. I encourage you to be thinking about your own community or state as we explore these next few pieces of the puzzle. Thanks, Deborah. So as I mentioned earlier, technology is one piece of this work. The next piece we're going to discuss is actually readiness. It's important to have an understanding of the context and resources available to you. And our team has identified 3 pillars of readiness. You want to advance? Thanks. So this first is community need. What are the current gaps or needs, and is there willingness to adopt new solutions? The second is community collaboration, how partners currently work together and communicate. And then finally, capacity. Is there leadership and available funding to drive this work? So we're going to dig into each of these pillars ever so briefly, and hopefully help you think about kind of the current state of your community or state and how this might apply. So the first we see here is community need. So when assessing community need, it of course is important to ask some fundamental questions. What challenge, whether at the community or state level, is motivating the desire to implement a new approach? What's the vision for how technology can help address this challenge? And what are some solutions that the community has previously explored? And finally, do relevant community partners fully understand the community's context, needs, and resources? So I hope that as we kind of move through these, again, you're thinking about your own community or your own state and thinking about what it is, what need brought you to this presentation today. If you want to go ahead and advance, we'll think about community collaboration. So which partners in the community currently collaborate? What sectors are represented and who isn't at the table that needs to be to meet this community need? Do partners have trusting, productive working relationships? And do they share a vision for addressing the current challenge? So again, who needs to be involved to address the challenge in your community? And is there buy-in? And then finally, thank you, Deborah, community capacity. Leadership and fellow advocates utilizing available funding to commit their time and effort to the process. So again, community need. In the state of Illinois to support this project, we were lucky enough to have 3 strong pillars to build upon. There was the need for equitable access to resources to give children the strongest start to life, the collaboration of home visiting networks with a shared vision and focus on early childhood, and the capacity provided by state level commitment and PDG B-5 grant funding, supporting local leaders and advocates in communities across the state. And so I'm going to test fate and try technology one more time here. I'm going to open up this poll, and I hope that as we were discussing kind of those pillars of readiness, it sparked some thought for each of you as to how, what challenge is motivating you to search for a solution. And so I'm going to go ahead and in the chat, I'm going to drop this link one more time. You're going to go to the same link and please tell us the challenge that is motivating you to search for a solution. And Deborah, I'm actually going to snag the screen share and hope this doesn't throw us off like it did last time. Thank you for the test. So anyone else, what brought you here today? And I'm interested to see kind of some of the similarities, some of the differences. I know during the previous presentation, difficult to navigate access to resources, families wanting a one-stop shop, not a one more stop shop. That's very
I'm
understandable.
sorry, Mary, you're still only sharing a black screen.
Oh, it must just be my computer. Thank you for that. I'm going to go ahead and just stop sharing then, and I'll let Deborah share. Thank you. Okay. So unfortunately, you can't see those responses coming in, but I appreciate those sharing them in the chat as well. Well, in this, for the sake of time, I know we got to move forward so that Deborah can tell us about these communities. And unfortunately, tech has derailed our timing just a little bit. So I'm just going to go ahead and move on and briefly talk about the implementation approach, the third piece of this puzzle. So as I mentioned, at the Center for Public Partnerships and Research, we developed a cultivating connections implementation approach to support communities in successfully creating change and adopting the use of technology. And so it starts with, if Deborah, you want to move to the next slide. Starts with groundwork, providing space and resources for local leaders to become experts and to create a detailed plan for engaging and implementing a plan with partners. Next, we provide local leaders plant those seeds with their partners that they've identified, generating buy-in, developing a collective vision for the future. And once the right partners are engaged, we can begin to develop the strong roots that are needed to, as we mentioned before, define shared processes, shared expectations, and create a collaborative network necessary to move the work forward and support families. The fourth phase of implementation is Iris Blooms. Organizations implementing community level decisions into their own organization and program level workflows, assuring successful adoption of the tool and shared processes. And then finally, the fifth phase is cultivate. It's ongoing and encourages families to communities to utilize available resources and guides to measure shared success and quality improvement, refining approaches as a collaborative. And so actually, Deborah, if you can go back to the previous, I'm just going to quickly touch on cultivating connections is best implemented when driven at the community by community-based leadership, those with knowledge, connections, relationships, and a trust of the community. And the next slide will tell you that we have found that when creating new processes within your community, it's of course best to start with a specific, well-developed vision, addressing community need and a group of stakeholders before strategically incorporating new partners and expanding community network or collaboration. And so that is all very quickly to say that the Cultivating Connections implementation approach is meant to be adaptable to the community need and flexible based on timelines and again, need and specific circumstances of the community. So my next section, actually, I believe I am just about at time, which is unfortunate. I will just briefly say that our next activity, which would have involved another technological trick, would have been describing our why for the work. Another kind of best practice or fundamental piece of this work that we have found is that when involving programs, individuals from multi-sectors, finding the foundation and the connection in whys, whether you're with healthcare, small home visiting programs, or state level staff. Often if we get to the heart of the work, that's where we're going to find the connectivity and be able to find the shared vision to be able to collaboratively work together. And so I am going to, Deborah, if you just quickly lead to moving to what matters. Yep, and you can just click through those. We have a moving to what matters framework that has, as I said, it's important to start with the why of the work, but we know that we need to measure our impact and be able to refine processes and focus on continuous quality improvement. And so it's important to be able to connect that why, of course, to get folks across different systems to buy into the work and be able to coordinate and effectively improve together. And so sorry, Deborah, I think I cut into your time, but I'm going to turn it back over to you to talk about the specific community work.
I also apologize. I don't think the slides, I had them synced up to Mary's presentation. So I'm just going to go through this really quickly. So for the PDG B-5 project, we selected 4 home visiting communities based off of this criteria. And a lot of this Mary has already gone through on what is required in the IRIS implementation work to be successful. A couple things I do want to point out is that funding wasn't provided for, or our funding was really focused on providing IRIS and TA support, but there was limitation to provide staffing support. So it was really important for us to choose communities that were, as ready as possible to take on this work. And some of those key indicators for us were collaboratives that already have an established and robust home visiting community/collaboration, as well as voluntarily already implementing coordinated intake processes or with a strong interest in doing that. And then already having folks in their community that are doing the work that aligns well with the IRIS leadership roles and responsibilities. So the first community that I want to cover is DuPage Home Visiting Network. They are located in DuPage County, which is a collar county right outside of Chicago and Cook County. They have been operating as a home visiting collaborative and a voluntary CI system for well over a decade. They are comprised of 10 organizational partners that offer 13 home visiting programs. And historically, their partnership has been incredibly strong. Their network is housed at the County Health Department, where the referrals, mainly WIC family participants, are distributed to their home visiting partners in the county. Their goal with this project was to enhance their already existing CI system, to have bi-directional communication with their partners, and the ability to outreach and incorporate new partners into their system outside of home visiting, such as social service agencies. The second collaborative that we worked with is the Madison County Coordinated Intake System, which is housed at the Regional Child Care Resource and Referral Agency, and they are located in Southwest Illinois and St. Clair County. This collaborative also leveraged a neighboring McPhee Coordinated Intake community in St. Clair County. So this CCRNR did not have an established home visiting collaborative to start with, but they did have a strong history of community partnerships with local agencies, prior success on taking on initiatives and projects and strengthening their local ECEZ system, and staff whose responsibilities lined up very well with the IRIS leadership roles. So through this work, they were able to establish a home visiting collaborative, and they have plans to branch out to the rest of their service delivery area, which is a multi-county region. Our third community collaboration is Sangamon Heart, which stands for Home Visiting Education and Referral Team, and they are located in Central Illinois and Sangamon County. Their work comes from Sangamon Success, which is a countywide strategic plan in improving maternal and child health outcomes. The top recommendation from this strategic initiative is to connect more children and families to local home visiting services. Their collaboration is housed and led by the Southern Illinois University Medicine Department of Pediatrics. Prior to this project and prior to the pandemic, they had just organized into a home visiting collaborative, and they had a specific interest in coordinated intake systems. But then, the pandemic happened and derailed this. But then through this project, they were able to reconvene and reorganize their collaborative, implement a CI process, and they're connecting with other ECEC providers in their community. Oh, I'm sorry. And finally, our fourth collaborative is the Sauk Valley Stars. They're a home visiting collaborative led by the Regional Office of Education in Northwest Illinois, and they cover 3 counties, Lee, Ogle, and Whiteside. They also are an early childhood collaborative that's looking to strengthen their relationships with home visiting providers, as well as strengthen coordination across these different services. In their position at the ROE, they've been involved in several local initiatives, as well as those at the state level. And this has been really beneficial for them because it has allowed them to garner interest from partners across different sectors to join their IRIS network. For example, 2 local hospital systems and their service delivery area have expressed interest in joining an IRIS. And for home visiting programs, that connection to the medical field is just really good. I believe we are at time. So I think the last thing I want to point out is that for all of our communities through this work, they've been garnering a lot of attention from different partners outside the home visiting system, as well as interest from local funders. And we're hoping that their network can continue growing stronger, as well as continue gaining these interests and support. So we have 5 minutes left, and I think we're going to just move on to any questions that folks have.
All right, well, feel free if anyone has any questions to either drop those in the chat, or if they want to unmute themselves, we can take questions that way. But I know Mary and Deborah are very willing to respond to any questions that you might have for them. So there's a question that came in. Is there a plan for sustaining IRIS after PDG B-5 ends in the local communities?
So I can start with that, and then Mary, if you feel like you can add anything, like, feel free to do so. This is a really great question. One of the reasons that we took on this project is that IRIS is such an effective tool, but not only that, it is also a cost-effective tool. This is one of the more affordable platforms that communities can take on. And so that was one of the reasons we went into this, so that once the PDG B-5 program has ended, collaborations still have the capacity to be able to sustain this in their community if they weren't able to gather any local funding support to continue this work. It would still be manageable. It could be a cost shared amongst all the different partners. And that is something that we communicated at the start of the project from the get-go. We were saying, you know, it's going to be a priority for you to start looking for local funding support who'd be interested in this work and sustaining it in the long term. With that being said, we are also planning for the next year to continue sustaining these communities. So fingers crossed for that.
Any other questions? What is planned for 2022, and how does this effort address progress?
Hi, Richard. I'm glad you asked that question. So for our application next year, we wrote in to continue providing this platform to the communities, but also to provide staffing support to manage these networks. You know, just from the information that we provided, all of this has been done voluntarily, but we also know that community systems development work is a lot of work, and it takes a lot of time, effort, a lot of intentionality to maintain those partnerships as well as developing it out. So we are planning to provide funding for that. Separate from that, on the statewide level, the McPhee CI program in the future is planning to NOFO out our CI communities. So we're hoping that our communities will by then be well positioned to apply for those funding and receive that. In addition, additional plans is that for 2022, towards I think like September next year, that's going to allow the communities to have operated IRIS in their community for 1 full year. And we are hoping that that will generate enough data and very just aesthetically pleasing data reports that IRIS provides that they can provide to their partners as well as local funders to show, hey, this is a really amazing platform. Wouldn't you want to support this in our community? It can also show the equity impact that we're having in our community.
Any other final questions that folks want to ask before we wrap up for the day?
Go ahead.
No, you go ahead.
I already asked my question. Go ahead.
You said that it had some really elegant data reporting capacities. Could you talk a little bit more about that?
Yeah, as we know, oftentimes our collaborations are, sharing data. It'll be like on an Excel form, on Microsoft Word. So it's just, data is always different from different people to be able to digest that information. But with Iris, it's already built in so that whoever's managing it can just hit export report, and they can set the time that they want the referral information from. And from there, it generates like these beautiful graphs and just clean cut numbers so that folks can see just very clearly, this is the number of referrals that were processed. These are the number of referrals that were closed. This is where the referrals are coming from, the total number per partner that's in the network, and etc. And for ours, we incorporated it's not in the report, but it's able to report out the equity data information also.
It's really great. I have one follow-up question, if it doesn't interrupt everybody else, just about how can that be integrated with other technological solutions?
That's a really, really great question. Mary, do you want to tackle this now, or do you want me to?
Absolutely. And for the sake of time, interoperability could be quite the discussion in and of itself. And so I will just quickly share that we are having those conversations with multiple different types of other software. And so if there is a need, we are happy to kind of dig into that conversation to meet the need, explore the opportunities. But yeah, for the sake of time, I guess I'll leave it there.
Yeah, I just want to add real quickly, this is not a case management platform. This is purely a referral communication platform. So it layers on very well to other data systems that folks may be using.
So Deborah, this is Richard again. Have you seen any interest by other groups in the state, even though there may not be a way for them to join yet? Are there other groups besides the home visiting collaboratives that are at least curious about how to pick up on this and run with it?
Yeah, absolutely. Even just within the communities that we're working with, we're seeing, different systems like healthcare systems that are interested in joining Iris. And outside of the PDG B-5 project, there was already a strong momentum and spread of Iris popping up throughout the state. And so we're pretty optimistic and positive about how Iris is going to continue to grow throughout Illinois. It's in a lot of different conversations with different stakeholder groups. They're always talking about, do you know about Iris? What are the benefits of it? Is this something that our community collaboration wants to take on? So, for example, I know there was a restorative justice group in Sangamon County, and so they provide services for adults, but they were also having these conversations about joining the Iris network.
Thank you.
All right. Any final questions? Okay. Thank you, Deborah and Mary. We appreciate it. Yeah. I'm going to. Okay. Well, first of all, thank you everyone for joining us today. Thank you, Rachel. Thank you, Georgia. Thank you, Mary. Thank you, Deborah. You all did a phenomenal job presenting your work that you're doing in your state and your local regions. It was really great to hear about the state level collaboration and the community-driven solutions, as well as some of the shared solutions to build and address what we've heard from families. And I think that really touches on what we heard earlier today in some of the keynote and the welcoming remarks about really putting families and children first and designing systems around their needs. So thank you for focusing on that and really doing amazing work. I just wanted to close with a few logistics here today. Just as a reminder of the PDG B-5 TA Center website. So this is just a place that you can go for resources regarding improving equity, including children with special needs, enhancing mental health. And let me see if I can drop that in the chat just so folks have it if you not accessed it yet. We'll do that. And then also the funding authority. And then also if you would like to subscribe to any Office of Child Care announcements, the links there. And then lastly, as we wrap up, I just want to share the second resource, which is the Research Connections website. This is an online library of policy-related research that contains lots of information on topics that focus birth to 5 mixed delivery systems. And that website is www.researchconnections.org. So feel free to check that out as well. Otherwise, thank you all so much, and we appreciate your time, and have a great rest of your annual convening.
Thank you, everyone.
All right, take care.
Thank you, Howard. I got to have fun. Have a great afternoon.
Yeah, you too. It was a lot of fun. Great job.
Thanks.
All right, team, I'm closing up the room. Thanks, everybody.
All right, thanks. Bye-bye.